phone. In this week's Focus on Your Health, Teresa Snow shows us what that means for doctors and their patients.
Focus on Your Health is sponsored by MU Healthcare.
A cancer diagnosis is news no one wants to hear, and while some patients are okay with waiting, others would rather know as soon as possible, even if that news comes over the phone.
Stop breathing.
A mammogram, ultrasound, finally a biopsy. Testing for cancer can be a long and scary process. And if there's bad news to break, doctors say ideally it should be done face-to-face.
You're able to look at someone, you're able to see how are they reacting to the news and change how you're delivering things based on that.
But more and more frequently, patients and doctors are opting for a phone call instead. Researchers at the University of Missouri School of Medicine surveyed nearly 2,900 breast cancer patients. In 2000, about a quarter of patients learned about their diagnosis over the telephone. By 2005, 50% received the news that way. And in 2015, the number climbed to more than 65%.
I could speculate that part of it is the digital age. So I think that these days people are more interested, more connected, more used to getting information more instantaneously. And so that transcends to the healthcare.
In addition, test results are often made available to patients online, like through the MU Healthcare app.
I think the first thing we need to do is have that conversation with the patient. How do you want to hear?
The study has prompted professors at the School of Medicine to change the way they teach future physicians, preparing them to have tough conversations over the phone.
You still need to really check in and make sure that you're addressing emotions, being empathetic, listening, and then setting a follow-up appointment to talk about it in person is really critical.
As doctor and patient prepare to tackle cancer together. Joining me now is Dr. Kevin Staveley-O'Carroll. He's director of the Ellis Fischel Cancer Center at MU Healthcare. And no matter how the diagnosis comes, it is a scary time to hear you have cancer. How do you guide patients through that process?
Well, here at Ellis Fischel, a critical part of our 10 multidisciplinary teams are our navigators. And we have professional nurse navigators and lay navigators that really establish a relationship with patient and guide the patient through the process.
They're going to hold their hand from screening through treatment?
Absolutely. A good example would be our breast program. If a woman has an abnormal mammography, she gets a call from a navigator that really tells her about the process and takes her from that abnormal mammogram until a diagnosis of cancer. So when they're getting that bad news, they really know the person that's delivering with them, and they know what the care is going to be in the future.
Something unique at the Academic Health Center here is that we're working with people, in many cases, who are traveling quite a distance to come here for care.
Absolutely. You know, as a state-designated cancer center, it's our obligation to really coordinate that care.
And it's not just breast cancer. You're doing that throughout the cancer center.
All of the cancer center programs have navigation, which is really critical when you think about our patients being far away and coming here and having to have the care given at home as well as here with the different disciplines involved.
And you do it so well. Thank you very much, Dr. Kevin Staveley-O'Carroll. With Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.